Oxygen needed by almost every living organism, but some COVID-infected patients cannot breathe it on their own, which is why the demand has gone up during major outbreaks.
Our usage has gone almost tripled. We've gone from refilling our tank once a week, once every 7 days, to every other day mostly.
As for the portable cylinders,
before COVID, our demand on average was about 300 to 400 tanks a month we were going through, and it has more than doubled. Now we're running around 700 to 750 tanks a month that we go through of the full O2 cylinders.
Airgas, a local company that gets supply from San Diego, distills normal air, which is about 99% pure oxygen.
The supplier in the truck brings liquid oxygen and pumps it into our bulk storage tank. The liquid oxygen is roughly 300 degrees below zero, and as the facility uses oxygen, it pulls it out of the bulk tank, goes through a vaporizer which converts it from liquid oxygen into a gas, and then it's goes up into the hospital, and it's used by the patients.
The vaporizer conversion is about a 2-hour process.
When our patient load started to pick up again, we were using oxygen faster than we could convert it into a gas from a liquid. To stop that problem, we went down to the store and got a couple of garden sprayers, just standard garden sprayers, hooked them up to a garden hose, and they're spraying water on the vaporizers, which increases the efficiency of the vaporizer to turn it into gas, and that solved the problem.
Each day, nurses go patient by patient to assess their need for oxygen.
Due to the inventory that we do daily, and we make sure that that is being reported to supply chain, they are ahead of the game of what is our demand of oxygen.
Once news of the shortage trickled over to Yuma, the supply chain needed to be up and ready.
As soon as I started hearing about shortages in California and some of the Arizona locations, we proactively made plans in place to bring in a few extras, so we had some additional stock available, as well as strategizing on additional resources just in case.
These are the 5 to 7 pound cylinders that are placed on the hospital bed when transporting a patient within the facility. The supplier had to lay down some ground rules when the oxygen shortage first hit.
Our goal is to bring down as many empties as possible, so I have the supply chain staff go around collecting empties to bring them down, because Airgas, because of the shortage, they're doing a 1-to-1 swap. So they give us one full tank for every empty tank that we provide them.
But when a patient is stationary in a room, they get their oxygen supply from the wall, which comes from the tanks. If not converted properly, this can lead to other issues.
If a liquid pulls into the system and pulls into the patient room, it's being that cold, it's not good for you. Can't breathe it. So it also freezes up the piping inside the hospital.
Medical oxygen can be life-saving for some who have recovered from COVID, but there are those patients who will live with permanent side effects.
We have seen multiple people who have recovered. The only difference is that they walked in here with no oxygen need of a supplement, and now they're going home with a supplement of an oxygen, which some people do recover. It does take them months after they leave the hospital, and there has been cases some people are still on oxygen.
Healthcare workers are the final step in the supply chain, but it wouldn't be possible without the supply crew.
In supply chain, the model that we have that I have established for our team is fill in the hands that heal. Without supply chain, the clinical staff would not be able to treat the patients the way they need to. So I think supply chain is very critical to the whole organization, because we have done everything we can to ensure that we have protective equipment for the staff, as well as the necessary clinical supplies needed for patient care.
Yuma Regional Medical Center said it did not have to go into ration care, but had the oxygen supply run out, that may have been a possibility. Reporting in Yuma, April Hedinger, 13 on your side.